When you study Lyme disease, it's important to look oftentimes at animals that get the disease, and our pets are some of those animals. And dogs actually act as sentinels for the disease. They're 50% more likely to get the disease than humans, and the reason for that is, let's face it, they're free spirits. They roll in the leaves, they run in the woods. They're like kids in some ways. They don't pay attention when you call them back. And so the dogs go in there, they pick up these ticks, and they end up getting Lyme disease and other tick-borne diseases like anaplasmosis and others. And so this is important to look at in a community, for example, let's say, that doesn't have Lyme disease. Now, all of a sudden, maybe the veterinarians in that community are saying, oh my gosh, we're seeing a load of Lyme disease in our dogs. That should give the medical community a heads up, because that means if it's in those dogs and they're getting it, that people are now going to be increasingly getting the disease. So that should be a warning, a red flag. And unfortunately, it isn't always that, because there's a lack of, oftentimes, of communication between all of these groups, and they don't give that information forth. However, there is a Companion Animal Parasite Council, which is a group, and what they do is they tabulate the data on different diseases in animals, and especially in dogs. And one of the diseases they tabulate is Lyme disease, and that is mapped where those cases are across the country. And it's great because it will tell you, for example, that New Jersey and New York, 1 out of 10 dogs tested positive. And other places it might be 1 out of 6 dogs, or it might be a lesser amount. And that gives you an idea of what is really happening in that state. Now, why is this significant to human disease and surveillance in these states? Is because there are several states that are considered, they don't have any, supposedly do not have any ticks that carry and transmit Lyme. Those people cannot get diagnosed oftentimes for the disease, because the doctors will not even look at that, because they say there's no disease here. So then the question becomes, well, how does the dog get it? So the answer to that is always, well, the dog must have traveled out of state. Well, I have to tell you, we have some pretty wealthy dogs in many of the states, and a whole lot of them are doing a lot of traveling. Now, the reason I say it that way is because the CDC also has indicated in those states that people who get the disease travel. That's how they pick it up. So about 2012, I wrote to them and I said, so give me the data that you have that shows that it's always travel in those states that causes a disease. Well, they don't have any data that shows that. And they obviously told me that. And so therefore, my thinking is, well, look, if we have the dogs there picking this up, and we really, can't determine, apparently, if they've traveled out of state or not, how many of them, what does that mean to risk, then there's obviously a problem there that needs to be looked at. And I believe if there was closer cooperation, that we might get some studies perhaps done on that, which would show maybe that indeed, maybe those ticks are really there. Or maybe there's another vector that they don't know about. There's often discussion of that.